Welcome to the Noise Podcast. It is week 4 of term 2, and we have two very fascinating conversations for you today. We have Silly Hour with Mia and Dia, and me, Alex, talking about last week's production of Whose Play Is It Anyway by Nuts, UNSW's Theatre Society. It was a blast, and we had a blast. We also have the start of an ongoing conversation about UNSW's health service, but also just the healthcare industry as a whole and the state of it. And I will be joined later on by Ren and Freddie, Noise co-writers, with me to talk about that. Hope you enjoy. So to reflect on a great night out at the theatre that the Noise team went on, welcome to Silly Hour, Whose Play Is It Anyway edition. Silly Hour Nuts edition. I like that.
We would have a lot of Nuts edition Silly Hours if we would, could.
We are silly and also nuts.
Yeah.
You are. And is that a hint, wink, wink to Nuts to do more plays so you guys
Nuts,
can
invite us to more plays. We love you guys.
Yeah, we had a really good time. I'd also like to say we have been vying for Alex, Dia and Mia Silly Hour for a while, and we're very happy that we're here.
They finally
shout out
got
to
me.
you for getting sick. Finally.
Exactly.
This is like the most unhinged Silly Hour possible.
So what were your first impressions of Whose Play Is It Anyway? We'll get into the individual plays to start with.
I think we should start with disclaimer, my involvement.
Yeah, you have a bit of a conflict of interest in this.
So Dia wrote one of the plays.
Yeah.
I would just like to say it was brilliant, but Dia did write it.
I think you need to reach out to someone. I still stand by that.
What? What do I have to write?
Like to get it on a stage, for reals.
Yeah, like just like only someone who goes to therapy could have written that, I think.
Oh, I thought you meant like reach out to someone to get it like properly produced.
Oh, I mean...
Maybe both.
I mean, I do want to write a full version, but I'll probably only do that if Trinity wants to direct it.
Fair enough, because Trinity's great. We would just like to say a big shout out to Trinity. She did a really good job directing, as did all three of the directors, actually. They were really beautifully directed pieces.
But special shout out to Trinity, because like writing something and then giving it off to somebody is like such a difficult process as a writer.
It's so rewarding though.
Yeah, and just knowing that she took it and then like made it so rewarding for me as a
But
writer.
also like making it into what she did was amazing. She did a beautiful job.
Yeah.
So how different was it from the start? From what you
we should
wrote?
probably explain like what this piece was about, like really quickly. Dia, do you want to give us a quick
Yes.
rundown?
Okay, yeah. Just very briefly before we even talk about my piece, Whose Plays It Anyway is a collection of 3 short plays. So mine was the third on the night, and there was 2 other plays which we will talk about afterwards. So we're not talking chronologically, but my play was called The Undetectives, and it was about a silly gang of people who work for an agency where they frame people for committing crimes instead of solving crimes themselves. So like a bit of a hitman kind of situation. And the like premise of the story is that they accidentally recruit somebody from the police academy who thinks it's a real detective agency, and they have to like go through hijinks to try and cover it up.
So they're like posing as the detective agent, as like the police, but they're actually the mafia.
Pretty much.
Basically, it was very funny, and also like the particular characters as well were all like really well suited to each other. There was a lot of different like archetypes there, which were really fun.
It was good casting all round,
Absolutely.
not just in that play.
Yeah,
Like
the casting was incredible.
Yeah.
Mia, what was your reaction to Dia's?
I thought it was really funny. So like all 3 of the pieces were really good. I would say the first 2 both had elements of comedy and like a certain soberness to them. I think this one was like just like Die Hard hilarious.
That was the most striking thing to me. It definitely had a downward trajectory of sanity.
Yeah,
Through the
definitely.
entire night. The first play was, we'll get into this in a moment, the first play was so serious and heartfelt and real and human. And then the second play, I had absolutely no idea what was going on, 10 out of 10. And then the third play was just so far removed from any concept of reality
No, you're so right. It really was.
that I couldn't believe I was in the same theatre as the one that was the first
Well, I'm not
performance.
even sure if they were smoke machines, but if they were drugged. Like, we were all going on a trip. We were having an experience going there. I'm really glad we did, though.
You guys haven't seen this production, and you can't anymore because this was a year ago, but shout out to whenever they put on Burns, a post-apocalyptic play, or as I call it, Burns, a post-apocalyptic sleigh, because that entire show was also split into acts, Act 1, Act 2, and then intermission intermission, Act 3. And Act 1 was like pretty mellow, pretty somber, serious. Act 2 was like, there was a hint of comedy. And then we come back from intermission, and I was like, what the fuck is going on? I feel like I took a tab of acid in the best way possible.
So I have seen the actual play Mr. Burns, and it is like that. And it is one of my favourite plays I've ever seen. I was honestly, when I heard, because I was around, I knew some nuts people who were doing that, and I was like, how would you do that in a theatre in a uni theatre production?
And they did amazing.
That was,
shout out to Anastasia for directing it.
Anastasia was also a fabulous actor. We probably shouldn't be like doxing her like this, but she did a beautiful job acting. She like really embodied that character.
Since we've done this backwards, let's move on to...
Oh, wait, I just want to give one more shout out for Undetectives. Everyone was really amazing and really well cast, but I really want to say Bora as James was like a real standout to me, because I've seen a good chunk of Nuts Productions, and I was like, who is this new person I've never heard of? And I was like, holy shit, that is like one of the most talented character actors I've seen in my entire life. Where did you come from?
And he was playing...
James.
The bald guy.
The bald guy.
He was also great.
You're right, character actor.
Yeah.
That's a great way.
So good at comedy, perfectly embodied the character.
He uses his body well.
Yes.
They all like really committed to the comedy.
It was the most physical performance of the night, for sure.
For sure.
Since we're moving backwards, I'll move on to The Wait, the second play. I've already said my little piece about this. It was definitely in the realm of absurdism, but it was, I think, fantastically produced.
It was so good. It was so good.
I also think the physical comedy of Isla and Susie, who played the couple in the second half, was so like... I think, like, what's the word I'm looking for? It juxtaposed really well to the beginning, where the whole comedy was that, like, the delivery of the waiter is so, like, stoic, but, like, goes on these weird monologues, and then juxtaposing that with the wild, outlandish, like...
But also, like, as someone who works in hospital, I was just sitting there being like, someone sitting at a table... We are not very much, but there is so much going on there. And that's what I felt like was going on. Like, hearing from him and hearing such an intense and somber but funny and weird internal monologue from him, that's exactly how I feel.
What was the name of the actor again?
Rayon.
Rayon Khan, I think.
Yeah, Rayon Khan as the waiter. No one on the night commanded that stage more than he did.
Absolutely.
He was phenomenal. Yeah. And just... had us laughing the whole way through in a way that you wouldn't expect.
Obviously it was meant to be intentionally funny, but the way that it was written was not in a joke format.
No.
Like, it wasn't intentionally like set up punchline. It was just his delivery, and the particular like content of what he was saying was just so absurdly funny. And
there was a moment where he first talked about, I don't even remember what the context was, but his character was talking about like a feeling of overwhelming joy and love, and then he compared it in a later part of the monologue to this feeling of overwhelming hatred and burning, seething anger at someone. And me and Mia have this one person, and I'm not going to say
Alex and I don't bond over a huge amount, but this one person we bond over big time.
And when he said this stuff about burning, seething hatred, Mia and I just looked at each other, and all we needed to do was nod.
Pepsi's never going to let us all do silly hour
never again. This is why I love us being silly. Someone has to stop us eventually.
I will not. This is why Pepsi has to edit.
Because they are never going to like not be the host again, because you automatically agree with silly hour. Pepsi has never and never will agree with silly hour.
I didn't think I'd agree with silly hour at first, but I'm warming into it.
Silly hour was fucking fabulous. See, we know what we're on about.
Yeah, and the other thing I wanted to talk about with The Wait was the as you said, the performance of the couple in the play, two women but playing a very straight couple.
Yeah, it was really funny.
They ate it up.
You could tell they were looking forward to the gender bending.
I don't know who it was that played Elliot, but whoever that was did a stunning job.
Oh.
Okay, Isla did an incredible job playing Elliot. That character, like the humor that like they brought to his character was so good, so perfect, and like playing a straight man that way was so funny.
Oh, you know they rehearsed manspreading.
Absolutely.
Like
yeah.
I can see them like sitting at home in the mirror like
Yeah, like
measuring.
learning how to manspread
Yeah.
properly. You're so right. But
Yeah.
also like, also whoever played, was it Sandra, right?
Sandra.
Whoever played Sandra did like a beautiful job and really did convey like what it is like to be on a date with a straight man acting that way.
Yeah.
Like that was really good, but also just the way that he was played was just like so brilliant and made us all hate him in the best possible way. Like it was so funny.
Yeah.
Should we move on
Yes,
to
'cause we're running out
One
of time.
Confession?
We're big time running out of
What was the
time.
name again?
I think it's called One Confession and a Funeral.
One Confession and a
Correct,
Funeral,
yeah.
which pretty much explains what it's about.
I really like that they started with that piece. They
Yeah.
didn't have to, and I think in many ways they wouldn't have necessarily. I'm still really glad that they did.
I think it would have been the most challenging to pull off for everyone involved. It was a lot simpler. It required it depended a lot more on delivery, and it depended a lot more on building tension and convincing the audience to connect with the characters. And they did that so unbelievable. I was in awe. I was in awe.
And also, even though Rayan spent a lot of the time on stage alone, all of the other pieces were quite group ensemble pieces. This was a very, like, connected, it was just two people on the stage. It was a very, like, intensely emotional moment just between two people, and I really liked that.
It
and
was.
again, I'm really glad they started that
But
way.
I think they used comedy really well as well. Even though it was a very heartfelt, emotional piece, it started very comedically, and I think that might have been what got us to connect with the characters. The play starts with two friends at the funeral of one of the friends' boyfriend. Very dark, awkward situation, and you'll be surprised how much humor they made out of that. But they captured the awkwardness and the bleh of the situation.
But also, like, what I quite liked about it is that actually I've been to a decent amount of funerals. Funerals are, like, funnier and more kind of personable than you might think they would be. Like the way that they're often portrayed, I don't think is how they often end up being, and having such an interesting but like out of the blue conversation happen at a funeral, I don't think that's too off base.
Yeah.
I feel like we've glazed up nuts so much on everything they've done, so I'm going to take the opportunity to say one thing that I did not like, which is not even something I did not like, it's just something I would not have done, and this is why. I did not like that they kissed at the end of the play, because...
Me neither.
So I actually don't mind that they kissed. I think it was a very, like, heart in the throat moment, and also I think they lent into the fact that you wouldn't normally expect that from a uni theatre. And
That's...
Or at a funeral.
or
Okay, my reason for not is I love the tension of the will they
was
kiss,
so-
will they
Yeah,
not
exactly.
kiss.
So you know what I would have done? I would have had them kiss, but fuck it up. Like, I would have had it be the most awkward shit. Like, I was once in a play, right?
Alice Neil Shakespeare moment.
Where the two, it was Pride and Prejudice,
Oh,
actually.
go off.
And
Oh my God, not you.
the Lizzie and, what's his face? Darcy. I was Mr. Wickham. The Lizzie and the Darcy had a kiss at the end, right? And the Lizzie went in for just like a little peck, and the Darcy went in for like a full.
Oh no.
And it was the most awkward thing.
I also love the comedy that like of Darcy really just wanting to make out.
Yeah, and Lizzie just like.
Yeah. Okay.
I would have had something like that. I wouldn't have had it be this like romantic, emotional embrace. I would have just had it be like this two really awkward lesbians in a really awkward situation.
Yeah, just coming back to the whole like lesbianism moment of this, I feel like just knowing lesbians, it's not gonna happen that way. Also, I feel like if I was gonna end it anywhere, I would have ended it when she just said like shit. I just would have ended it on the swear word. That's where it would have been, and I like don't think it needed to go anywhere else, because I totally agree with Dia that the tension was really beautiful and the best part of it. I'm glad that it ended in some ways just to move into the next thing.
Although I do think I would have extended it a little longer than that, because I think the best part about the play, the most enjoyable thing about the play is seeing how much these two characters care for each other.
That's true, and also the fact that they start out so far apart and come so far together.
Also, I have an Easter egg that I know from my inside knowledge of nuts, which is the back wall of that was covered in posters, and if you look, one of the posters says "Missing Cat, Mr. Fuzzles" from the Undetectives.
Oh, that's funny.
Which is
Very
cute
nice.
little cameo, cute little Easter egg.
So glad to you all. Those are the best theatre productions where everyone's kind of...
Yeah. I just want to give a big shout out to the lesbians as well.
Shout out to the lesbians,
I
guys.
love lesbians. I love watching theatre where you can tell that everyone had a good time making
Yeah.
Like, that's one thing that I loved about watching Undetectives. I was like, I love that you can tell these guys are having fun during this.
Yeah.
Dia had a little cry.
Okay, I did, okay? I'm
I
sorry.
would too.
Yeah, but I
Absolutely.
did cry. And
It's your piece, it's your work, it's your baby.
and
As
also,
it should
like,
be.
I joked to the people, the cast of Undetectives, that I'm like their deadbeat dad that like birthed them and then walked out to get milk and then came back on their 18th birthday. But
That is the vibe of your play.
yeah.
A little bit.
But like, it's like, oh my god, my children are all grown. They're going to college.
All
So
right,
to wrap this up, we'd like to
Pepsi-
give a big shout out to Nuts.
Shout out to Nuts. Shout out to lesbians. Shout out to theatre.
Shout out to anyone that's participating in student theatre. We think you're doing a great job.
Shout out to Anastasia specifically.
Big shout out to Anastasia. And to every single person on the cast, every single one of the directors. We had a really fun night as well, just to say. Alex?
I think that's the end of Silly Hour.
Thank you for hosting us. We're really glad
Thank
to
you,
have had you.
I'll be back soon, I'm sure.
Probably not. Pepsi's gonna listen.
Pepsi is never gonna let this ever happen again.
And that's where we'll end it.
Definitely. Much love.
I'm joined by Ren and Freddie, who are probably the most experienced with the health service out of everyone. Freddie doing a peace sign on a podcast. Well done. Where do you guys want to start?
Well, we could start by talking about the issues with the wait times that we've seen. There's a whole article about that on the website already.
I suppose that is the most front-facing issue for healthcare. Is that the majority of necessary things people get, they have to wait for. I've just been on a wait list for 3 months, and that was just for a psychologist. I'm sure you guys have faced.
Yeah, so the thing about wait times is that speaking with, no offense, but healthy people, and also speaking with a lot of doctors as well who are predominantly very healthy
How
people.
dare you call me healthy?
I'm not saying you're healthy, you're on a wait list, you're fine, you're one of us. Is that there is kind of an idea of people don't really understand why waiting a couple of weeks for care or waiting a few months is such a problem. Because it's kind of like, whatever. For most people, they go to the doctor, they get their checkup, they go home, everything's all clear. But the issue kind of comes in when you have an acute health issue. So obviously the most obvious answer that we talked about in our brief article addressing some of the really urgent and acute massive wait times that the health service was experiencing, which came in junction with some sort of computer system problems, is that if you have something like a viral infection that requires significant antibiotics, if you can't get to see a doctor for 3 weeks, your immune system can basically be fucked in the time that it actually takes for you to get an appointment with a doctor. Additionally, another thing Ren and I talked about as your token sick people is that when you have complex health needs, it is not as simple as just seeing whatever doctor is available. Even if you're just dealing with something like a cold, in my experience before, I personally had pneumonia. Because if you don't see a doctor who actually understands the rest of your health background and how that is going to impact any other kind of issue you have, even if it's something as simple as I walked on my leg weird and it's been weird for 2 weeks and I'm getting a bit worried. The other thing as well is that if you are someone who has sort of a complex health profile, which is the sort of fancy way of saying you have a lot of health issues or you have a specifically diagnosed or undiagnosed condition, that is weird and fucks up your life a lot. You can't kind of just see whatever GP is available, which is something that is often thrown out in sort of arguing against, these wait times are really bad. Because they go, the earliest doctor we can actually see at the moment, for example, the health service, the earliest appointment you can get for any GP is 1 week from now, which doesn't sound so bad. But if you have a complex health history, you need to see someone that you're familiar with who actually understands that. Because if that doesn't happen, you can get seriously mistreated and have some really awful things go down. I mean, a great example for me personally, I have seen doctors before who don't understand my health history, who have intentionally misdiagnosed me with conditions that every other doctor I've seen agrees that I don't have because they purely didn't do their research and didn't understand.
And so this is something that I think, as your local healthy people correspondent, I think a lot of people who just see a GP regularly don't understand how important, how problematic it can be when you see a new person and they go, okay, what's up with you? And you're like, here's all my history, here's everything the other doctor has said. And I'm like, I still don't know what the other doctor. It's not a matter of reading a paper. Yeah. It's you have to get a doctor that knows you and has gotten familiar with how you are as a person.
And additionally as well, there are tons of different conditions which will impact the way you respond to medication, will impact the way you respond to acute health events like infections, like injuries. like even just, stress under the right circumstances. And that's like before we even get into some of the stuff that other people have talked to us about in terms of like obtaining prescriptions, medications, particularly because usually if you have a kind of complex or chronic health condition, the kinds of medications you're often on are not the sort of things doctors are willing to just give out to someone they've met for the first time today.
Ren, you've lived in America.
Yes.
How different is it over there compared to... We always hear a lot about the American health system. Have you felt it more or less than you have in America?
Well, to be honest, the experience I had in the US was I had very good health insurance. Health insurance is done through the employer in the US. And to be competitive in the industry, we had to have quite good health insurance. But the wait times, because all the doctors I saw basically were at either the same practice sort of thing, or it was with an associated hospital. It was decent in the care that I received, but again, a lot of the issues weren't properly addressed anyways. But yeah.
I mean, it's my understanding as well, though, that in conversations in the US around healthcare, one of the arguments that is often brought up against bringing in kind of more government subsidized healthcare is the idea that, the wait times are going to get really long. But the thing is that wait time issues isn't actually just a matter of, the government's funding it and so whatever. Because the thing is that like even in Australia now, if you don't want to go to a bulk billed GP, which is very important, that is what the uni health service is for all students, and I'm pretty sure staff as well, it is bulk billed, which means you don't have to pay for your appointment, which is huge. I mean, I personally go there because I cannot afford to pay to go to a doctor as often as I need to go to a doctor. And the thing is in Australia, if you don't want to pay, you have the option of going to a non-bulk billed GP, and chances are you might be able to get in faster. But that isn't, for me, that's not an argument that means the government shouldn't sponsor healthcare, because these issues with wait times, as I have been investigating for a piece that will be coming out sometime in the future, go way beyond issues of just like too many people seeking healthcare. Because really what it is that the support for health professionals is not there, the staff that is required is not there, and there are very complex social and political reasons why it's not there that can be prevented.
So am I right in having a suspicion that doctors who bulk bill at the moment will not make as much money as doctors who don't?
So it's a little bit complex, but basically yes.
Yeah.
There have been a lot of articles by a few different news publications, including the ABC, looking into essentially the problem is that all bulk bill GPs, particularly in rural areas, keep quitting.
Right.
They don't do it anymore. And part of that is to do with the way the sort of funding setup works and how you get paid when you primarily bulk bill, like where you get your money from and how it goes through sort of the government and Medicare and stuff.
Well, I thought all the practices had just a regular price, and whether they charged the government or the individual for it, they didn't care. They just charged a price for each service.
Now, I would need to look a little bit more into that because my memory's a little foggy, but off the top of my head, it is not that simple.
Right.
But the issue is as well that the kind of expected price for the kind of services they're offering, which is important to note as well, is that we are currently in a pandemic. We have been for the last 4 years. And whether or not you're someone who still actively takes COVID precautions or not, whatever you believe about COVID, although the evidence shows it is very bad, it is something that has triggered a lot of health problems in the population that we haven't previously had at this extent before. We know that we have a sicker population than we did 10 years ago. I can find you a source for that. And the other thing as well is that we are dealing with an aging population, which means there are a lot more people trying to see GPs and trying to see doctors.
You see this going around a lot, but a lot of people like you, I've heard you say this so many times, that depend on people wearing masks still, that are acutely aware that COVID is not over, the pandemic is not over, and are aware of that because they may well die if they don't. What has changed and what needed to happen to stop us from getting in the situation we are in now?
Ooh, that is a question I don't know that I feel qualified to answer, but I mean, the thing is that it connects to a lot of broader cultural issues that we haven't worked out with in terms of how we as a society view things like sickness, death, disability, whatever. What I can say, bringing it back down to a smaller, more manageable level, it is very notable that the majority of doctors that I have seen in the University Health Service do not wear masks in their appointments. Even my own GP within the last month has stopped wearing a mask to appointments, despite the fact that she knows and she has said herself she would be quote unquote very worried about me if I contracted COVID. And that their job is seeing sick people for a living.
So we've lost this social expectation, and even doctors are falling for this social shift.
Well, you say lost. I think, if anything, we haven't really had it. So the thing is, you go, okay, well, in the first couple of years of the pandemic, everyone was wearing masks, but that was when the messaging was very much still, you only have to worry if you have an underlying condition. And, wear a mask because you don't want to get it. There was a little bit of an attitude of community care, but once it sort of got to the point where people found that the psychological burden of having to, not being able to do all the stuff they're used to doing, and on a political, state level, the financial burden of not having sort of like industries work the way they used to became too much of a pain. That dropped. And we look at historically, like, we saw the same thing happen after the 1918 Spanish flu. There was a rise in eugenics in the 20s.
Well,
And
I don't have an underlying condition, not a physical one at least. And in 2020, 2021, I would hang 2 or 3 masks on my door, and I would never leave the house without putting on one of those masks. And I've fallen out of that habit. And I really shouldn't have. But I probably can't say I'm the only one who's fallen out of that habit either.
I mean, you're asking the wrong person if you want to know what it's like inside the mind of people who don't take precautions anymore. Because I've been taking them this whole time.
I mean, I went to health service this morning. They no longer require people to wear masks. I think I was the only person in the building wearing a mask. And the doctors were not. Oh, actually, I think my GP was. But everyone else there was not wearing masks. No one in the waiting room was wearing a mask.
I mean, people just cough into the open air now as well. Now, I swear to God, we were all raised with the cough until your elbow, and people don't even do that anymore.
And which is
bizarre.
We were saying during COVID that we would never leave this. We would always go out with masks, even when the pandemic was over. And now that it's not as bad as it was, supposedly, we're still not. We've fallen out of those habits, which has really surprised me. And you guys are saying, are people going to die because of that? Because of that shift? Or are people just
People already have died because of that shit.
Yeah.
People are dying because of that shit. People are gaining debilitating lifelong conditions that will probably one day lead to them dying because of that. And I do want to say there are a lot of disabled writers out there and doctors who are talking about this a lot more in depth and a lot better than I can do. Lucky Tran as well has also done a lot of writing. Amani Barbarin has talked a lot about sort of the ongoing attitude to public health and disability, because you cannot separate it from disability. We are dealing with an illness that is disabling, and which the majority of public health messaging has been, you don't need to worry unless you are disabled.
Which has been reflected in the laws.
Yeah, very much so. But then as well, being worrying in itself, particularly, I mean, if we want to talk about the United States again, but also over here, in itself has become pathologized. I mean, there have been incidences of really prominent advocates for long COVID communities and people with conditions like ME/CFS, which is very commonly associated with COVID infections, but not exclusively, being pathologized and diagnosed with mental illness on the basis that they still take COVID precautions. There was one woman who spoke about being sectioned, which is being involuntarily committed to a psychiatric ward during a hospital stay because she was asking the medical staff that came to treat her to wear an N95 mask.
Jeez.
And they didn't want to do it. And she became distressed at the fact that medical staff in a hospital ward, which is the place where sick people go, did not want to do that.
I'll leave people to postulate on that. The last thing I've got on this on my notes is shout out to the pharmacy. That's all I know about that. Ren, is that one of yours?
More Freddie.
That was a joke. No, we just would really like the pharmacy on campus. For all, I do want to say, we have a lot of criticisms of the health service, but most of those are not exclusive to the university health service. They are kind of a big issue with medical care at large. But we wanted to contrast that by saying the pharmacy here down here at the Quad on Henson campus is great. They're very nice. I mean, I love them. I don't know, Ren, how do you feel about them?
They're always very nice. Always.
What are they just They're just generally helpful?
They really go out of their way as well.
They do, yeah.
I know as well, I personally have had difficulties obtaining stuff where I'm I go to the pharmacy, they don't have it, they always offer to order it in. My wheelchair can sometimes be a bit hard to get around the store because most of the different buildings that are retail on campus are
Is
small.
it the one near Plume and... No, that's the chemist.
They're right across the Quad from the health service.
Oh yeah, that's... So I did have the right one.
They always move stuff out of the way for me if I get
those aisles are really narrow.
Yeah, however, I mean, basically every store on campus has extremely narrow aisles.
Yeah.
But they're the only staff who will move things for me. So I just wanted to give them some appreciation. And also, if you are looking to buy some N95 masks, you can get KN95 masks from that pharmacy. They have them right up the front on a nice little shelf. They come in black and white, and I believe they got some hot pink ones recently.
The Noise Podcast is not sponsored by the UNSW pharmacy. Anyway, I'm sure you guys will be back because this is certainly not a conversation we can cover in one podcast, but thank you for being here. We will see you again soon, or hear you again soon.